Hi, I'm Dr. Cy Vincent. This is my wonderful, amazing, beautiful wife, Jeanette. I posted a video on YouTube sometime last year, I think, or the beginning of this year, talking about testosterone replacement in young men in particular, but also my own story. It resonated with a lot of men out there. A lot of people have seen it, which is great. But there were a lot of comments, of course, lots of positive and then some negative, as usual.
Get the haters, and then lovers. And we don't have time to respond to either.
Yeah.
But we wanted to address some of them.
Right. I don't look at social media. I don't look at the comments. So she has told me that there are some negative, critical comments, and I just thought it would be important to address
there's some
them.
Really good ones too.
Yeah. The good ones we don't really need to address in this video. People who are pro using testosterone, of course, don't have issues with it, but it's important to address the people who have relevant criticism, I guess, and those who have other forms of criticism. So that's what this video is about. She's just going to tell me what they say, and I'm going to respond because I haven't looked at them ahead of time.
Are you doing just regular questions too?
Well, if there are good questions, yeah. Good
right.
questions.
Okay.
Sure.
All right. So what's your opinion on the fertility issues if you go on TRT, and also the higher cancer risk at higher age using testosterone?
Okay. So infertility is not really the right word. Infertility would suggest that it somehow impairs your fertility long term. That's not an issue. Testosterone replacement acts as birth control. So you should look at it as hormonal birth control. Just like a woman using a birth control pill or an IUD with a progestin in it, you're not fertile while you're using the therapy. And then when you stop the therapy, you regain your fertility like normal. The Chinese did a big, long study, like 7-year study with 1,000 guys that showed that it was 99% effective as birth control, meaning 99% of men had no sperm production while they were on their TRT. And then when they stopped it, they all regained their sperm production like normal. So there's no long-term impairment of fertility. That's not a concern. If a man wants to regain their fertility and have a child while they're on their TRT still, which I highly recommend, my last 2 children were born through that method. You just have to use HCG at the same time, and you don't have to stop your testosterone or reduce your dose. You just regain sperm production while staying on your TRT, which is great. So there's really no impaired fertility using TRT. That is a myth. Cancer, that's also a myth. There is no increase in cancer risk, including prostate cancer, which is the only one you would really conceivably worry about on TRT. There is no increased risk of prostate cancer on TRT. That's been studied repeatedly and completely put to bed. So those are concerns that are not really valid, but good things to bring up.
All right. So MK Turtles brings up, it does not make sense to need a drug to feel better in most cases. I think we need to just look at things with more love, patience, and understanding.
Okay, cool. 90% of the world uses caffeine to get up and go in the morning and to be more productive and feel better, which is a drug, plant-derived drug.
But testosterone's not a drug. It's
Testosterone's not a drug, right? Just because it's available at the pharmacy doesn't make it a drug. It's a hormone. And if you are deficient in a hormone, you will feel it. Like if a woman is deficient in estrogen, she'll have fatigue, night sweats, hot flashes, depression, brain fog, vaginal dryness, and then you replenish that lacked hormone and all of those symptoms get better and life gets better and you live longer in some cases. Like testosterone replacement helps men live longer, happier, healthier lives. So it's not a drug. That's not a valid comparison. It is something you are lacking that you are supposed to have. And that is the right way to frame it in your mind.
And your body's already making it. It's just efficient.
Yeah, it's something that your body produces. Does your body produce drugs? No, your body doesn't produce drugs. Our bodies are all full of chemicals now, including drugs. Anyone who lives in a city and uses city water to cook with, to bathe in, and to drink, you're taking lots of pharmaceuticals every day. And they don't necessarily make you feel better either. That's a whole separate issue.
Eat at McDonald's.
Yeah.
You can get more chemicals than that.
You're getting a lot of chemicals in your food and everything else, and testosterone's not a drug. Should not be discussed as one.
All right. How long until it starts working on testosterone? Cypionate, please.
Well, testosterone cypionate or propionate or enanthate or like the ester form really doesn't make much difference. Men, if they do injections, they will feel if you use a big enough dose to where it's actually going to work, you will feel it the next day. It will peak on day 3. But the full effects, like the consistent effects and where you're going to settle in, takes about 5 doses. And I like to inject every 3 days. So 15 days, 2 weeks, you'll see what you're really kind of going to get out of it. And that's also when you'll start to notice whether you're making excessive estrogen conversion or not. And you'll see those effects by week 2 also. So the first shot, men might feel all these benefits and feel great. By the second, third, fourth shot, they may be making a lot of excess estrogen. And then they might start to sort of notice some negative effects creeping in. And that's when you need to have your labs done, be evaluated, get everything
And a lot of
out.
people attribute that to testosterone, and it's really the estrogen. And that's why managing the metabolites is so important, and your loved ones, your partner will probably notice it first. So listen, when they say, hey, something might be a little off, make sure you check that, because that's where you get the irregularities.
Most of the men that I talk to who say they've used TRT in the past and did not have a good experience, it's one of two things. It's either that the dose wasn't enough, they needed more, or very commonly they had a high estrogen conversion rate and nobody addressed it properly. They had their high estrogen, and either the doctor said, well, let's cut your testosterone back so you don't have to deal with the estrogen, which is a mistake because then you're not getting any of the benefits you're supposed to get. Or they just didn't deal with the estrogen conversion problem, and men had all these excess estrogen symptoms, which tend to overshadow the benefits of the testosterone. It's not complicated, but that has to be checked and it has to be addressed properly.
All right, and this is a big question. We could probably go on for a long time, but keep it short. Why are testosterone levels going down?
Oh, testosterone levels have been dropping steadily, at least since the 80s. It's been looked at, if you look at the Massachusetts male aging study, that one started in the early 80s, and it has demonstrated a 1 to 2% per year decline. So that's 40 years ago now, which would mean we've lost more than half of our testosterone. If it's like 1.5% per year on average, we've lost 60% or almost a third of our testosterone that we're supposed to have. And if you look at reference ranges, just in the last 20 years, since I've been prescribing testosterone for men and since I've been testing myself, the reference ranges used to average 750 and go up to 1200. And now the most recent reference ranges posted in 2025, they go down below 200, like 190, even 170 something is the lower cutoff. And the upper cutoffs are now in the 700s or 800s. So the upper cutoff is now what the average was 20 years ago. We don't necessarily know for sure when it started to drop, but we know that it's being caused by all these chemicals in the environment. Glyphosate, which is Roundup from Monsanto and is in all of our major food and all municipal water supplies and every human being in the world now. Glyphosate is one of the most prominent ones if you study individual chemicals. But plastic chemicals like phthalates from any plastic products, bisphenol A being a plasticizer also, and a lot of other chemicals also at least partially impair testosterone production. So taking them all as this mass exposure is like the general answer to all these chemicals that are in our bodies now. Males are being exposed in utero at higher and higher levels, and that means that their testicles never turn on. Their adult Leydig cells that make testosterone as an adult never mature in utero, and when that boy hits puberty, nothing happens. They don't turn into men like they're supposed to. That's why I talk about looking at this in teenagers so much.
Yeah, and I look at a lot of labs and a lot of different ranges, and they all vary. They all make up their own estimated range of whatever they think is within range. And if your practitioner is practicing based on lab value ranges, that's not right.
No, those lab values are taken, those ranges are taken from existing populations of men and looking at where they are. So if the whole population of men has been poisoned for the last 50 or 60 or 70 years.
The only ones that are getting tested are the ones that are having problems.
Right.
That's your pool.
Yeah, they're testing men who are broadly deficient and saying, here's your reference range. Nowhere on the reference range does it say optimal or normal. If you're looking at a hormone and all the things that it does for human health, you should really be considering what is the optimal range. And the reference ranges are not based on clinical outcomes. They don't reflect what's good for men. They never have. There is no laboratory test where the reference range is reflective of what is truly optimal for that person. If you have a doctor who knows what they're doing, they should look at the research for where reference ranges are derived and treat you according to what they think is optimal and what's good for you in your situation, not just the reference range. And hormones are one area where the reference ranges are sadly often way lower than where people truly do well.
All right. Next question. Total testosterone at 2000 will highly elevate hematocrit and hemoglobin.
Yeah, which is a good thing. So there's this common misconception that having elevated blood cell counts, like red blood cell mass, which the hematocrit reflects and the hemoglobin reflects, is somehow bad. It's not. Athletes go and get blood transfusions to cheat in like the Tour de France and other endurance races, and they use erythropoietin injections to raise their own red cell mass to cheat in athletics because it gives you better performance. There is no evidence, there's no scientific study, because I've looked thoroughly and I've had a doctor who ran the blood bank in Alaska do a thorough research evaluation. There is no research that shows that having a high hematocrit, like 58%, even 59% in some cases, is detrimental. It does not increase the risk of stroke. It does not increase the risk of blood clots. It does not have any change in the viscosity of your blood like people talk about. There's no downside. It's not a concern. I just had one of my friends do his labs and his hematocrit was over 58%. And he's been there for years. And I've had my hematocrit in the 55, 56% range at times. It's usually around 54. This is not a problem. It's actually a performance enhancing aspect of TRT. More red blood cells means more oxygen carrying capacity and delivery to the tissues when you need it. It's a good thing, not a bad thing. So yes, it raises your hematocrit and your hemoglobin, but so what? That's a good thing, not a bad thing.
All right. And we get this from moms a lot. They're really concerned. For the love of God, don't put your sons on drugs or anything other than that as a last resort.
Right. Those same moms might very well have their kids on an anti-anxiety drug or an antidepressant or Adderall or some other thing, right? Again, hormones are not drugs. Hormones are things your bodies make for a good reason to promote optimal function and health. If you had a type 1 diabetic son, if you had a type 1 diabetic daughter, which means they don't make insulin and they're going to die in a few weeks, would you not give them insulin? Because you shouldn't give them a prescription drug. Why would you give your child a prescription when their body should be making that themselves? Yeah, I agree. I'm a type 1 diabetic. I have to use insulin or I'll die in a fairly short amount of time. Should I not use insulin just because I shouldn't need it? I agree I shouldn't need it. I would love to not take it. If that kid over there had a growth hormone deficiency, like if one of your kids had a growth hormone deficiency, he's 6 years old, but let's say he was 12 and he was this size because he had a growth hormone deficiency. Should I not give him growth hormone because that's just the way nature planned it for him, or that's just how it worked out?
And
no, it's ridiculous.
And when the kids were 16, they consented to this. It wasn't like dad shooting them up. And it was proper diet, proper exercise.
Yeah, they're always doing that. They're playing sports.
They're all
they're
like
well.
tormented because he gets up every morning and makes them bowls of vitamins as his love language, and they all scoff at it. Right. So we put a lot of energy into feeding our family well, making sure they're healthy, their mindset, all the things are in place first
Yell at them when it's appropriate.
Before testing for these things when the time is right and the age is right.
If you see that your young male child is changing their behavior, their activity, what we see in the teenagers, the males that have low testosterone and they don't get the surge during puberty they're supposed to have, is they suddenly deflate. They grow. This guy has totally normal energy. He's rambunctious. He's all over the place. That's what you see. But then when they hit puberty and their balls don't turn on and their testosterone does not go up, what you see is this change. This child who used to be robust and playful and active and all over the place is now tired and sleeping more and taking naps and isolating and not wanting to go do things, and they seem depressed or anxious, and they're not taking charge of their life, and they're having trouble in school, and they're having trouble with their relationships, their academics and everything. They're just not showing any interest. That's what you see when a teenage male doesn't make testosterone. And it's this big decline in function and where the spark and the fire of life just isn't there. And then you check their testosterone and it's low, which like in the middle teen years, like 16 years old, you should have a testosterone level of 2000. You just should. That's where normal males used to be. And there's evidence for that. It's not me making it up or me guessing. It's what I've experienced by treating 1,000 men, myself, family members, friends, children, loved ones, and all these patients I've worked with. When you get their testosterone up in the 2000s, that's where everybody goes, oh, now I understand how I'm supposed to feel. So if you've got a teenager who's 15, 16, and their testosterone's not there, all of this critical development that's supposed to take place from age 15 to 25, our brains develop till we're 25, is supposed to take place in the presence of a large amount of testosterone. So if you find that your young male is having some of these issues and their testosterone level is low like that, if you just want to accept it and decide that that's nature taking its course, go right ahead. But if you want your child to have the best shot at life, to have the best
Actually
performance,
hit puberty,
to actually develop, right?
Look at every senior class graduating. Are they boys graduating or men? Look back 30 years at what men used to look like when they graduated. Then go look at the senior class now. When
they did the presidential physical fitness testing. Go look up a video on YouTube of presidential physical fitness testing of 16-year-old high school males in the 1960s and 70s. They all look like athletes. They're like buff and muscular and fully developed. And this is like all of them. It's normal. It's not the elite. It's what we used to look like as a species. And now we do not. And that is not normal and is not something we should accept as normal and accept as our situation. You can address this. You can improve upon this tremendously. And I personally think that you should. If you want the best life for your child, which I do. When I was 18, 19 years old, I started lifting weights when I was 15. When I was 18, 19, I could bench press 400 pounds. I was a monster. I could do 25 pull-ups. I had no fat on me. I was all muscle. It was crazy. And I was just working out.
I have photos. I should have came prepared of what Ty looked like in high school.
Yeah.
And he looked like one of the 1970s people.
Oh.
Like he was naturally fit, buff, and then he has developed this physique, put on more weight because he's a type 1 diabetic and
insulin puts muscle on.
Exactly. So he's not a steroid head.
No.
I
never touched steroids. I never even knew anything about him. I didn't even take vitamins or supplements or creatine
and this
or nothing.
is not a result of testosterone.
No, I didn't.
I make him shave it because he had
hair.
like a mullet, and we're not going there.
I have a receding hairline and a widow's peak and a bald spot on the back because my dad did too, and that's just going to happen to some guys.
But if you don't manage metabolites like DHT, you will lose.
You will lose your hair, yeah. So
and that is men doing it alone without the proper guidance and information.
Without a knowledgeable practitioner to guide you, men don't manage the estrogen and they get all kinds of problems. They can get breast tissue development and then have to have surgery to remove it. They can have unnecessary hair loss and then get hair implants and stuff. That is unnecessary. You can prevent those complications, those consequences of testosterone therapy very easily. But you have to work with a practitioner who's aware of the issues and tests you and manages these things appropriately. It's not complicated, but it has to be addressed.
All right, and this guy had like the little finger first. When he said a lot of teenagers under 16 should use TRT, I started to understand that this human is suffering from Dunning-Kruger effect.
What was the Dunning-Kruger syndrome thing again?
Kind of like when you think you're the expert, so like you know it all.
Sure.
Yeah.
Other people come to me for help. I don't seek out people to impose my opinion on them. They pay me for my opinion.
Well, first, it's like testing at 16, not putting people on under 16. So listening skills, right?
I don't test them until they're 16. I didn't test my own sons until they were 16. At 16 is when we used to be adults. 16-year-old males used to be fully independent. They used to get married. They used to have their own house, their own job, their career. They used to have their own farm. They used to leave home at 16. Biologically, that's what we're supposed to be able to do. Our culture now is not aware of that because men aren't men anymore. Men don't develop like they're supposed to. But biologically, by 16, you should be an adult physically. You're not fully formed, but you're basically adult. You know, you could be, you should be. But now, you know, by 25 is when you really have full maturity of your brain, physical maturity and everything else. And then you keep putting on muscle and bone density till your mid 30s, maybe 40. So there's more maturation, but you should be biologically an adult at 16. Women for sure, and men too.
And I'm going to read this comment because I like it. My natural testosterone is 1150 at 48 years old. That's really high from what we've seen.
It is really rare this day.
My physique is very nice, thank God. My waist is fat and bulky, but my mood and potency are not exactly top notch. So I don't know it will be the golden bullet. Check your estrogen.
Exactly. There are so many men out there today who have crazy high estrogen levels, partly because of this chemical influence on our hormones
And it's
and the things in the food.
estradiol, and total estrogen.
And just
so
bad
you
food.
capture that xenoestrogen gap.
Total estrogens, and then you take away your estrone and estradiol combination, and you see this. We've seen people with this estrogen gap, we call it, where they're total estrogens, which that test measures chemicals that also resemble estrogen. So the total estrogens test will be like 2,000. And then a guy's estrone and estradiol might only total 200. And so there's 1,800 points of estrogen that's not real estrogen. But it does have estrogenic effects. It'll cause you to gain fat, to have fatigue, depression, loss of libido, sexual dysfunction. Estrogen is a major problem, and it has to be measured. So the guys who have seemingly adequate testosterone and they're having these similar kinds of symptoms and problems that are hormonal, it's usually high estrogen. And that's a separate issue, but it can be addressed, and it should be addressed.
One of the reasons I really don't do the comments because I get all riled up. So
I don't. People be hating. No. I don't care.
All right, here's one. Totally and completely irresponsible for anyone, let alone an MD, to put a 16-year-old kid's doing pretty much normal stuff on drugs.
Drugs.
I'm sure they'll get some great mass and lots of attention, but what happens in 2 to 3 decades to these boys?
Their life is so much better.
Yeah,
That's what happens.
they have a hormone they need.
Look at all the school shooters out there. They all look like very low testosterone males. Very low, very classic. All of these males that are entering the workforce, they need like a safe space. They have insecurity. They are tired. They're fearful. They're anxious. They're nervous. They're not productive. They're not happy. They're miserable, and they don't even realize it. I work with young guys all the time who, when they seek help for these problems, they're like, I don't understand like why I'm so tired and why I just have no confidence and no motivation, and I can't put on muscle no matter what I do. I just get tired and sore. I don't understand what's going on. And then I put them on testosterone and get their level in the 2000s, and they are blown away. Most men are primarily shocked at how their brain improves, their mental function, their cognition, their intelligence.
Like the number one thing for their mental health.
Oh my gosh, mental health is such a big buzz issue right now, and testosterone is often the solution for men. It is one of the most fundamental things for a male to perform the way they're supposed to, intellectually, in society, physically, all of it. Work, life, love, all of it depends on testosterone being adequate. You're not going to be able to make something out of nothing. You're just not. You're going to feel terrible. I was stunned at how much better I felt when I went on TRT. I had no real complaints that I thought of, and then I was blown away by how much things improved in my life.
And one of the things with Ty's dosing strategy is to start high, and then when you feel and understand what that feels like, you can work that way down to the economical dose. But if you've never felt a normal testosterone level, how are you going to discern between feeling a little bit better or feeling optimized?
Yeah. How do you know when you feel the best you're going to feel? You don't. And I will tell you that men who start on lower doses of testosterone and gradually go up will feel phenomenally better halfway there. You get their levels to 1,000 or 1,200. Oh my gosh, they're so blown away. Like, I feel so much better. And then I used to stop there. The reason I use larger and larger amounts is because of experience, clinical experience, and a desire to get the best possible results. And men who wanted to get the best possible results. So you find it. You gradually go up with your prescriptions and your blood levels, and I track people. I'm like, wow, okay, well, we're above the reference range now, but guys would still say, I still think I could probably feel better. Okay, let's try more. And you don't know unless you try.
And it doesn't have to stay at 2,000. If you feel fantastic at 1,500, stay at 1,500. Yeah. It's a customized plan. And that's the point. Right. It's everybody responds differently. Everybody metabolizes things differently. And you have to find what works for you.
Right. We don't know what the optimal range is. It's certainly not reflected in the lab results because the lab ranges have continually dropped and they keep dropping. So that's not the answer. The answer is Try more, see how you feel. Control your
honestly,
metabolites, see how you
parents, look at this. Test your kids when they're 16. See if this is something that should be in their body, if it's there. Because if their hormones are off, as women, we know our mood changes, everything else. And I think it's like this stigma with guys, like, oh, they have low T, well, there's some problem. No, it's the same thing. The number one thing I've seen for their mental health and just improvement is having a normal testosterone level. It completely changes their outlook on life, their ambition, motivation, mood, optimism, happiness, joy. And isn't that what we want? Like joyful, happy kids.
Multiple epidemiologic studies have shown that higher levels of testosterone later into life for both men and women is associated with longevity and quality of life. Better, longer life. I don't understand the fear, the concern, and the downside other than the fact that our culture has been declining and we think that must be normal. It's not. You don't have to live that way. This is a really critical thing.
Yeah.
All of these hormones, they make your body work the way it's supposed to. They replenish you, they rejuvenate you, they repair tissue, they heal you, they maintain bone density, muscle mass. One of the primary aspects of human existence that's associated with longevity is muscle mass, lean body mass. You cannot achieve that without your anabolic steroids being normal. DHEA and testosterone are your primary anabolic steroids. Growth hormone does not accomplish this. It is a joke. Growth hormone is not part of this process.
It's like pop medicine right now.
It is a farce.
With peptides and everything else. It's like everything in the Moreland classification and everyone doing...
Zipamorelin, Testosterone. They don't build muscle. They don't promote longevity. They don't. If you have a severe deficiency, you need it. Sure. Like insulin. Higher insulin is a bad thing, but you need enough insulin to survive. You need the right amount. And I have found through experience what the perfect sort of optimal range seems to be for men. And if you want to use less, go right ahead. I'm not pushing it on anyone. I'm just saying if somebody wants the best life they can have, you need adequate testosterone. And it's a lot higher than you think.
All right.
What else we got?
Tronanga 99, I'm going to call you out. TRT from age 16, target level of 2,000. This guy is a lunatic. First, you need to stay in your lane. The only person that gets to call him names is me. So shelf that. No mention of elevated hematocrit levels, which commonly happens with TRT. And at the levels he is recommending, it could be far more severe.
But there's no problem with that. Show me the research. I mean, if I'm causing a problem, I would like to know. Find the research that says having a high hematocrit is a problem. And not the research that's based on polycythemia vera, which is a bone marrow disorder that also has other problems associated with it that are primarily bone marrow driven. That's not TRT based. You can have hematocrits in the 58 range, 60% range. It doesn't cause a problem. There's no evidence that it does. It doesn't have to be addressed. You don't have to go to the blood bank and dump blood just because you have a lot of it. You need that blood. We need blood. Lots of blood is a good thing, unless there's a bone marrow dyscrasia, leukemia, polycythemia vera. Those may cause problems, but androgen-based polycythemia is not an issue. It's just not.
All right. Too many people going on TRT way too young. The possible side effects like blood clotting, not worth it once you've been on them for a long period of time.
Happen.
And you have to stay on them or your body will not make it naturally.
Your body's not making it naturally already. Using what you need is what you should do. I have to use insulin because I'm a type 1 diabetic. I have to take DHEA because my adrenals quit making enough DHEA. I take testosterone because my testicles quit making enough testosterone. And I have a much better life as a result, and I think you should too. Women will use estrogen and take birth control with estrogen in it. That causes blood clots. Estrogen does not increase your hematocrit, does not raise your blood counts, but it absolutely causes blood clots. Look up estrogen and blood clots. It is a huge problem. Nobody worries about that, but except we do. In medicine, we know that using estrogen can promote
And
cancer,
estrogen isn't a
weight
controlled
gain.
substance,
It's
but
not a controlled
testosterone
substance, but
is.
testosterone is. It's ridiculous. So all these things you're concerned about, look at estrogen.
And
not
look at like the
testosterone.
social stigma surrounding this, and like try to step outside of that and just like look at it for what it is.
Look at the science.
Who's making money and why?
Yeah. We have research. Look at it. Don't just
Well, they
say
bury the
these
good
things.
research.
I know. Don't just say these things without researching it. Lots of people, lots of doctors say these things because they're poorly educated, because they're uninformed. Educate yourself.
Is it
Read the
okay
research.
to take DHT blockers along with TRT to prevent baldness?
If your DHT is high. So I recommend measuring dihydrotestosterone, DHT, in every man on TRT because it often goes up as well. And you should control it with finasteride or dutasteride within the range. You don't have to take them every day. Anastrozole or other aromatase inhibitors to control estrogen, and 5-alpha reductase inhibitors like finasteride and dutasteride to control dihydrotestosterone conversion should be used appropriately. Because if you don't, with either of those, you'll get prostate enlargement, you'll get hair loss with DHT, you'll get breast enlargement, and all these other problems, and blood clots and things with estrogen. So those have to be looked at. It's part of the practice.
I like this one. Is TRT what made you go bald?
Nope.
Nope.
And I'm not bald. I shave my head.
Yeah.
I have about 75% of my hair. I just don't look good with it.
Yeah. It's a requirement that he shaves. All right. Low T is way unhealthier than TRT therapy. Correct.
Yeah.
All
If
right.
you need something, you should use it. And there isn't a way to raise it with herbs and supplements and all these bullshit things they talk about on the internet that they want to sell you products for. I'm not selling anything to anyone. I just think we should have a good life. And testosterone's part of that. A lot of it.
I like this one. I don't want to say TRT fixed all my problems in life, yet that's how I feel.
It fixes a lot of problems.
Yeah.
If you're deficient in something, that's what you need.
He's a dick when he's not on it.
Yeah. Men with low testosterone are not happy. They're not who they should be.
All right. I'm trying to scroll.
Just a couple more.
All right. How about, I know a lot of these are repeats.
Yeah. There's a lot of the same questions and concerns and criticisms.
Does
And
TRT have any conflicts with tirzepatide? Also, if I don't take the HCG, will I still have nut the same? Sorry for
Still
being
nut the same.
Yeah. Sorry for being vulgar.
if you use testosterone at large amounts, your testicles will shrink.
Men get concerned about this.
They get worried about it. Yeah.
But I don't know why.
I don't either. It's just easier to have smaller nuts. It's not a problem.
But you can fix
If
it
it bothers
too.
you, you can use HCG. Using HCG will resume normal testicular size and function. So if that's a concern, you can do that. If like bodybuilders and the athletes that use large amounts of anabolic steroids, their nuts will shrink a lot. So a lot of them use HCG to combat that. But I don't use it unless I want to have a child because who cares? I always tell men to expect your testicles to shrink by about half, about 50%. And so what? If you want them larger, use HCG and they'll go up. But that's just if you want to have larger balls and have pregnancies.
All right, so I like the video. However, I'm always shocked to hear doctors speak in such absolutes, which that concerns me too. Not with him because he actually knows his shit.
Absolutely.
Just curious, when you recommend children to take TRT, then compete in sports, if you also recommend letting the athletic association affiliation know about the sport and if the patient is doing so.
This is an issue because the NCAA does not allow the use of testosterone. So if a college athlete wants to play and not, break the rules, they can't use testosterone.
Right, but if they're a type 1 diabetic, they
They can use insulin.
Yeah.
Yeah, I know.
They're
It's a
deficient.
problem.
Yeah.
I think it's a problem. Our society has not caught up with it. It's an issue.
Right.
My concern is human health,
Right.
not sports.
Yeah, they'll have to examine that if it's a deficiency issue. I think
And you need to change their rules.
Yeah, I think healthy people are optimal and
better athletes. And we enjoy watching athletics. The bodybuilding world all uses massive amounts of anabolic steroids, crazy amounts of anabolic steroids. That's not what I'm talking about. I'm just talking, and they promote it. They support it. You can buy all this stuff online because the International Federation of Bodybuilding wants it. So it's available. But you should do it under supervision. You should do it with consciousness and caution.
all right, good video. But the part about gorillas having 10 times the testosterone levels as a human is completely false.
Okay,
Fact checker.
fact check it. Look it up. I looked it up. That's where I came up with it. I didn't guess. I didn't just make that up.
All right, I took testosterone for 4 years. Then my dick stopped working. Heaps of people face issues and they don't talk about it. Before taking testosterone, I never had an issue. On testosterone, I have never had an issue until I did. Now it's been 8 months on TRT to recover and still no good.
People need to check estrogen and need to check DHT.
It's a metabolite problem.
That's the only part of that. That's the only thing that causes that. Testosterone does not cause problems that we're aware of. It's the metabolites, estrogen and DHT and maybe others, but I haven't found any others.
All right, we can do this with new GT guy. It says, kindly give the middle finger to any doctor who says testosterone levels of 300 is normal.
Yeah.
You can do
Yeah,
it.
it's in the reference range. Doctors who say your testosterone level's fine because it's within the reference range are not paying attention. They have not done research. They do not know what they're talking about.
All
It's a
right.
problem. It's a huge problem.
Let's see. Hello. Does TRT affect chronic injuries? I'm 58. Have always been able to do things most guys in their 30s, 40s can't. But in the last couple of years, I've lost my strength, my muscle, my knees and my shoulders hurt. I'm suffering, man. I can't stay fit, and these chronic issues are depressing. I'm 58, but I'd really like to not be.
Yeah. That's one of the biggest issues I run into with it is chronic pain for no reason, injuries, poor recovery. I've had so many men who will tell me that they've had a bad shoulder or knee or back pain for years. They had an injury and it just won't heal. And I put them on the higher levels of testosterone. And within 6 months, they usually say, I can't believe it. My shoulder doesn't hurt anymore. I can lift over my head again. I can bench press again. I can do squats again. All these things heal. You will not heal if you do not have adequate anabolic steroids. You just won't, because that's what they're for. And our body makes them for that purpose. So good luck healing and recovering from your injuries if you do not have enough testosterone. You just won't.
Okay, and this is a good question, but doesn't TRT stop the body's own natural testosterone production?
Yes.
Doesn't TRT cause the testes to become dormant?
Yes.
Which is an
what?
awesome birth control
birth
option.
control, yeah.
It is positive
It's the
for
only thing we
men,
use.
and it doesn't mess with women.
Right. Women using birth control is a
It's
disaster.
awful.
They get horrible problems. Men using testosterone is the best birth control ever. And it's reversible.
And wouldn't you want to stop it at the source?
And imagine if a woman could have a birth control method that made them bigger, faster, stronger, happier, hornier, healthier. They'd sign up.
How about more glowing skin, leaner, happier?
All those things. Yeah.
It doesn't do any of those
More
things.
effective, more productive.
Yeah.
Happier.
Birth
Live
control
longer.
puts weight on you. You retain
I
water.
know.
You have mood swings. The list goes on and on and on.
The only thing we use is my testosterone. Don't need anything else.
All right. Once you start taking TRT, you can never stop.
Sure you can. Of course you can.
Yeah. Just
why
go
would
back
you
to your
want
old
to?
self.
I could stop using my insulin too, and I'd die. I mean, that's mythology. There's so many mythical beliefs out there in our society about testosterone that are not true. Do some
Everyone
research.
can do what you want to do.
Yeah.
Try it. You don't like it? Stop. Who cares?
Yeah.
We're not telling you what to do.
You go right back to where you were.
It's just is clinical experience.
People come to me for help. I help them.
All right. There's a lot of concerns about needles. Oh my gosh, what is the deal with guys in this needle fear? It has to be something ingrained.
Needles
in,
are strange.
Why are they so scary?
Needles are scary. I get
it's
it.
like a little poke.
Well, yeah, but it's a commitment. A testosterone injection requires a larger needle. It has to go in the muscle. It's a thing. But I have had very few men who would not inject themselves. Once they try it and they see how they feel, they go, "Oh, no big deal." It's just a weird thing, And some people are terrified of needles for whatever childhood trauma they had or whatever. And I get it. It's not a normal thing to see yourself with a needle.
Please don't turn to pellets, because the pellets it's problematic. They all get put in the same time, dissolve at the same time.
Big needle,
and then
huge, giant thing they shove them through. It's not better, but it's only every few months instead of every few days.
That's true.
It's just one of those things. Some people do not like it.
All right. Increased aggression.
Not from testosterone.
It's usually estrogen. That's the one that
estrogen will make you angry.
And sad and cry about stuff that you're not normally going to cry about, or irritable.
That's cultural mythology with real testosterone. When you're talking about some of the non-bioidentical anabolic steroids, those will make men angry.
Yes.
Trenbolone, equipoise,
Winstrol.
Those are not bioidentical. They're not the hormone we were made to
for
use.
Animals.
So they're unpredictable.
Not made for us, right?
No.
So stay away from things that are not bioidentical.
Yeah,
and there's a big difference in how people respond and their mental state, and those are two separate conversations. We are only talking about bioidentical
testosterone.
Yeah.
Does not make men angry. It makes men less angry. So many men I've had go on TRT and then their spouse is blown away by how much nicer they are, how much less irritable, how much happier. It's not what our culture thinks. It's not the roid rage thing. Is not what happens with testosterone. That's the other anabolic steroids that are not supposed to be in our body.
All right. Please research hidden risks of TRT that nobody talks about. I personally would stay as far away from it as possible.
Go ahead. You don't know what you're talking about.
Yeah.
If you manage this correctly, that won't happen.
But research bioidentical hormones versus all the other steroids, and then try to make your own opinion based on that. And properly managing the metabolites, especially estrogen and your DHT.
The concerns are not based on testosterone. They're other things.
All right. Perhaps your boys stay up too late. I would be leery of prescribing tea to a 16-year-old.
I'm not.
So yeah, as parents, we do all the things like screen time, diet, exercise, you name it.
And the boys with low testosterone sleep a lot. They don't stay up too late. They might stay up, but they sleep. They're tired. They come home and take a nap. That's one of the most common things. Naps. We shouldn't need naps.
All right, so this is either Mr. Stark or Mrs. Tark 539. There's no period. So you're insane. Again, stay in your lane. I'm the only one that gets to call him names.
Okay.
All right. I'm so thankful for your allergy LDI. It has changed my life.
That's different.
I was just telling you the good one.
Okay. We'll probably wrap this
All right.
up. I think we've covered most of what people talk about.
All right. What about gyno? Last one.
Estrogen.
Yep.
Testosterone doesn't do that. Estrogen does. If you're going to use testosterone, you have to check your estrogen. You have to control it.
All right. That's it for today, guys. Thank you so much.
Thank you.